Federal Health Minister Patty Hadju joins me now from her home riding of Thunder Bay. Nice to see you, Minister.
Nice to hear your voice, Rosemary.
So I know that there have been a lot of questions over the past week. When will this happen? You can understand why people
what
are.
Hour, yes.
Yeah. Could you maybe explain to Canadians why that is a hard thing to answer right now?
Well, it's a hard thing to answer because there's a lot of moving parts, Rosemary. There's obviously on the manufacturer side, the completion of the work that they're doing to get the doses ready and to finish, their own quality control processes, which are very important to everyone. There's the regulatory approval side on our side, which is really making sure that we have all the data from the manufacturers so that we can fully assess the safety and use indicators for the vaccines, and all of that work with provinces and territories that's going on as well to make sure we have plans to deploy vaccines. And then on top of it, there are a number of different kinds of vaccines that require a number of different kinds of considerations for transportation, storage, etc. So that work's happening, but it's hard to pinpoint an exact date for sure.
Do you understand Canadians when they get word, that so-and-so has an appointment in the United Kingdom and so-and-so's been told this in the United States? Do you understand that Canadians are a little frustrated with not having a clearer picture?
I think Canadians, for sure, we're all frustrated. Yes. And I do understand that frustration. I think I share it deeply. And also I'm not so much frustrated as I think more anxious, right? We're all anxious to get out of this mess as a world, but certainly as a country as well. And I think obviously other countries are doing their planning and all kinds of speculations are happening around timelines in other countries, much as they are here. But as Canada's health minister, I'm staying focused on Canadians and on our own process, making sure our delivery plans are well laid out and that we have what we need in terms of being able to deliver on the variety of different kinds of vaccines. And first and foremost, actually, that Health Canada has what it needs to make sure that the regulatory process is smooth and we can assure Canadians that whatever we approve is safe.
You talked about the complexity of at least Moderna and the Pfizer candidates who have to be stored at different temperatures and that kind of thing. There's also the fact that this is a highly contagious virus, so we can't just put everybody in a school gym and vaccinate them. What can you tell me about what might be on the table for how it will work? What you've discussed in terms of where people will go or how people will get it.
That's right. Well, so you're absolutely right. And I think, your question points to another part of this, which is an important consideration, is that it's not all going to happen at once. And so for every country around the world, this planning is going on right now. For example, figuring out who the priority populations are to get those first vaccines. And as we have more and more vaccines that are approved and plentiful, of course, one of the things that I can tell Canadians is that Canada has a long history with immunization. And in fact, over the flu season, immunized 16 million people successfully over the last several weeks. So we've got systems in place in provinces and territories that know how to do this well, efficiently, and safely. But that is part of the planning that's happening with provinces and territories. At the federal level, we'll be delivering a vaccine to depots in some cases as determined by the kind of vaccine, in other cases directly to provincial public health authorities who will then distribute it further through the province.
The support for vaccines seems to be softening actually over time compared to some public opinion polling that has been done. And I wonder how you manage that concern. I know that you don't want to make it mandatory, and many premiers don't want to make it mandatory either. But what are your concerns around the people not anxious to be first in line actually?
Well, first of all, I think there's a normal amount of hesitance, especially when we're talking about the novel vaccines that are new technology. And I think one of the things that's important for me to remind Canadians is that the reason why we stand strong on regulatory independence in this country is because we actually don't want political interference in our regulatory system. And I know the Conservatives have been pushing the Prime Minister, for example, to approve a number of different kinds of things, whether it's tests or treatments or vaccines. And this is why it's so important that we say to Canadians that we will never interfere with the regulators' work. They have to be independent so that they can make those decisions free of political influence. And that can give Canadians comfort that whatever they approve will be safe.
I know that you're going to do, the government is doing these regular vaccine briefings now once a week, but I do wonder, Minister, if those shouldn't have started sooner. We're a couple weeks away from what Pfizer at least getting approved in this country. And it just seems to me that there was a bit of a lack of information, even though the government had it.
I think every step of the way we've been sharing with Canadians information as we've been gathering it. And certainly I think now that we have better certainty from the provinces and territories in terms of what their plans look like. Look, healthcare is ultimately delivered through provinces and territories. So the federal government has a very important role in getting tools and equipment and treatments. But at the end of the day, we're there to help the healthcare delivery in provinces and territories, which is under their jurisdiction. And so, that's part of the planning, is making sure that provinces and territories have what they need. We've been acquiring, for example, syringes and swabs and a variety of equipment, including refrigerators that are ultra cold to store Pfizer. But this really is a Team Canada approach. And I think as we have more certainty around provincial and territorial plans, we'll be able to come to Canadians with a much more fulsome package. And each week there will be more details unfolding.
The Prime Minister sort of alluded to it in how in the ways that he does on Friday about things getting to places where they need to be. And what we understand he was talking about was rapid testing. Some provinces had been, screaming out for rapid testing for a long period of time. And we understand that some rapid tests are sort of just sitting there. What's your understanding of whether rapid tests are being used enough by provinces?
Well, we know that some provinces and territories have not deployed them as rapidly as we thought they would be, especially given the call for rapid testing, for example, in Ontario and some of the other Western provinces that were very early on saying we need rapid tests. And of course, there is a good example of Health Canada working really hard to understand how a test like a rapid test that we know has, for example, less accuracy than a PCR lab test could be deployed. So not only was that process careful and thoughtful, but also there is national guidance that all provinces feed into that allows for better understanding about how to use these tests and what circumstances. So I share the Prime Minister's eagerness to see those being utilized to their fullest capacity. Some provinces have started doing that. Nova Scotia is using them, for example, in the bars and restaurant sector. I know Ontario is starting to roll some out in long-term care homes. These are obviously great ideas, and also will generate the data for all of us to understand how better to use these tests.
We saw over yesterday, actually, in Alberta, a large protest around the lockdown. We have seen growing frustration from Canadians, whether it's around wearing masks or having things locked down. At the same time as we're seeing record cases in many of those same provinces. What goes through your mind when you see that, Minister?
Well, first of all, I actually feel sympathy. I feel equally frustrated as Canadians. This is so difficult for all of us. And as Christmas arrives, as holiday seasons arrive, people are torn. I think about the decisions people are trying to make about whether or not they comfort someone who's alone at Christmas by inviting them into their house, or whether or not they protect them from the potential infection of COVID-19. How impossible are these decisions? So I get the frustration. But I also think we have to hang in together for the next several months. There is a light at the end of the tunnel. The vaccines are going to be an important tool to beating back COVID-19. But until then, we've got to get there together, because people's lives are depending on us acting together.
Last question about the economic update. I'm wondering whether we would expect to see some things around long-term care, because there is a promise now for some national guidelines, or even speaking to some of the other roles you've had in government around childcare and getting women back into the workforce.
Well, listen, I think all those those two things you've mentioned are critically important to our government, and certainly to women and families around the country. I can speak more formatively to the long-term care standards. I think I don't think there's a lot of opposition to the idea of having a national set of standards across the country that would ensure that no matter where a person is aging, that they have assuredness that they're going to be able to age in dignity and safety. I mean, this is a tragedy. I'm not sure you've spoken
to the Quebec Premier then, Minister, because there is opposition. There is premiers are very leery of anything that includes a national standards.
Well, sure. Listen, I think getting to a place where we have a national standard there's going to be obviously lots of negotiations involved, and provinces and territories are going to have to weigh in. And that's the nature of being in a federation, is that we may not all agree on how we get there. But I think we do all agree that we have to do a better job protecting seniors in long-term care homes, because in fact, across the country, this has been a dramatic and terrible loss for our country. And quite frankly, we can prevent that in the future. And I think that all Canadians agree that no matter what province you live in, you should have assuredness that either you, who is a member of a long-term care facility, or the family member knows that person is getting decent and dignified care.
So we'll see the beginning of that work tomorrow. Is that fair to say, Minister?
I can't say what's in the Fez, as you know, Rosemary, but I because quite frankly, I'm not the one delivering it, but I know my colleague is excited to let Canadians know what our plan is. And I'll tell you this, we are focused on getting through the pandemic, making sure people have what they need to get through this. And we'll do whatever it takes, as the Prime Minister and the Deputy Prime Minister have said, because of course, Canadians know that when we act together like this, when we protect people's livelihoods, economic, futures, and their health, that's when we're strongest as a country.
Okay, Health Minister Patty Hadju, good of you to make the time for us this Sunday morning. Appreciate it very much.
Thank you so much, Rosemary.
Okay, see you soon.